What I'm about to share with you tonight is something that most people over 60 will never hear from their physician, despite the fact that it directly affects their heart, their cognitive function, and their ability to live independently. The position your body occupies during sleep is not a passive or neutral variable. Emerging research from institutions studying the physiology of aging now indicates that certain sleeping positions can increase the risk of stroke, progressive memory loss, and chronic pain by more than 60% in older adults. And the most consequential part of this finding is not the number itself. It is the reality that the overwhelming majority of seniors are placing themselves in these positions every single night, without any awareness that something is wrong and without anyone telling them otherwise. For millions of older adults, sleep has already become a source of exhaustion rather than restoration. The body that aches before morning arrives. The fatigue that is present regardless of how many hours were spent in bed. The restlessness that no adjustment seems to resolve. But what if the fundamental problem is not how long you are sleeping? What if it is how? Science now has enough to say clearly that sleep position functions as either an ally or an adversary to the aging body's healing processes. The identical hours of rest can decompress a spine or compress it further, ease inflamed joints or strain them, support the cardiovascular circulation your brain requires through every sleeping hour, or quietly work against it. The difference between these outcomes is not expensive equipment or medical intervention. It is information and the decision to use it. Tonight, I am going to give you that information completely, the 4 sleeping positions most harmful to adults over 60, and the 4 that can genuinely support your energy, your memory, and your physical ease in ways you may not have experienced in years. Stay with me through everything that follows. What you are about to learn has the real potential to change not just tonight, but every night from this point forward. If you have not yet subscribed, please do that now and activate the notification bell. Information this relevant to your specific stage of life should never be missed. And if today's conversation delivers genuine value to you, please type 1 in the comments. If it does not, please type 0. Your honest feedback shapes everything I create for you. I am Dr. Lauren Hayes. Part 1: The 4 worst sleeping positions for seniors. Position number 1: sleeping on your stomach, lying face down. The appeal is real and familiar. The body settles into the mattress, the face finds the pillow, and there is something genuinely comforting about the sensation of the world receding as you drift off. Harold, a 72-year-old retired carpenter from Ohio, described it to his physician exactly this way. "It feels like my back relaxes," he said. It was the only position in which sleep reliably came to him. But what Harold was never told across years of medical appointments was that the comfort he experienced every night was quietly and consistently damaging the structural health of his neck, his spine, and his breathing capacity, one night at a time. For older adults, stomach sleeping is not a harmless comfort preference. It is a position of sustained mechanical strain on some of the most structurally vulnerable areas of the aging body. Consider what the neck endures. Throughout the entire duration of sleep, the head must remain rotated to one side, maintaining an unnatural and prolonged cervical twist that compresses the blood vessels supplying the brain and presses against the nerve roots running along the spinal column. Night after night, this repeated mechanical stress accumulates. The body's response emerges as chronic stiffness, recurring morning headaches, episodes of dizziness that seem to appear without cause, and that familiar tingling that radiates through the arms and hands upon waking. Most people attribute these symptoms to circulation problems or simply to age. They rarely connect them to the hours they just spent with their neck rotated at an unnatural angle. The American Chiropractic Association has identified this position as a consistent contributor to cervical misalignment, a structural condition with measurable downstream consequences for balance and coordination that are particularly dangerous for older adults navigating daily physical environments. The respiratory consequences are equally significant and equally invisible. With the front of the body pressed against the mattress, the diaphragm cannot complete its full range of motion during breathing. Every breath across the night is shallower and less efficient than the body actually requires. For someone over 60, this sustained respiratory limitation means reduced oxygen delivery to the heart and the brain across every sleeping hour, contributing to cognitive fog, deepening fatigue, and blood pressure that is quietly elevated by a cardiovascular system working harder than necessary. The lower back receives its share of the burden as well. The sustained lumbar arch that face-down sleeping places compressive mechanical stress on the vertebral structures, a serious additional load for anyone already managing spinal arthritis or disc disease. Dr. Lauren Hayes describes this as among the most aging positions the spine can occupy during sleep. The cumulative vertebral wear it produces outpaces what normal aging alone would generate. The comfort is genuine in the short term. The structural cost is also genuine, and it accumulates silently across years. But if stomach sleeping carries these consequences, what about lying on the side? It feels natural, even protective, but it conceals its own dangers that deserve careful examination. Let us look at those now. If you are still with me and finding real value here, please type 1 in the comments. Position number 2, sleeping in a tight fetal curl with the knees drawn toward the chest. It is one of the most instinctive postures the human body has ever known, a shape that preceded our entry into the world. Knees pulled upward, arms folded inward, the body curved around itself as though creating a personal shelter from everything outside it. Eleanor, a 68-year-old grandmother from Michigan, had slept this way without question for the entirety of her adult life. "It feels safe," she described it, "like holding myself through the night." But after years of waking with deepening shortness of breath, persistent back stiffness that extended well into her mornings, and a fatigue that accumulated regardless of how early she went to bed, her physician offered an explanation she had never considered. The position that felt most protective was the one most consistently preventing her body from restoring itself through the night. The tight fetal curl produces a specific and predictable set of physiological consequences that intensify with age. When the knees are drawn closely toward the chest, the diaphragm is compressed from below. Its capacity to expand fully with each breath is mechanically reduced. The body compensates through faster and shallower breathing. For older adults whose respiratory tissue has naturally lost some of its elastic recoil, this sustained limitation in lung expansion means reduced oxygen availability through every hour of sleep. The accumulation shows in chronic morning fatigue, persistent headaches, and a quiet but real additional load on a cardiovascular system that depends on adequate overnight oxygenation. The spine absorbs its own consequence. Hours maintained in a tightly curved C shape progressively shortens the posterior musculature and the ligamentous structures that maintain upright posture. Over months and years, this mechanical shortening contributes to the forward spinal curve and stooped appearance that are commonly attributed entirely to age, posture that develops in part from how the sleeping hours are spent rather than from aging alone. The practical consequences reach directly into daily stability and fall prevention, two of the most consequential health priorities for adults in this stage of life. Eleanor's comfort had slowly become a habit systematically withdrawing from her energy reserves, her posture, and the physical stability that independence requires. The fetal curl feels like protection. For aging bodies, it frequently functions as a quietly damaging trap. Let us examine next the position that generations of physicians recommended as the gold standard, and the serious hidden risks it carries for older adults. Position number 3, lying flat on the back without adequate support, commonly called the soldier position. For many decades, this was the recommendation physicians most often gave: straight spinal alignment, even weight distribution, a clean and orderly posture that seemed to represent everything sensible and disciplined about how a person should rest. But for adults over 60, the actual physiological consequences of unsupported flat back sleeping are considerably more dangerous than this simple recommendation ever acknowledged. Robert was 74 years old, a veteran from Florida who had slept flat on his back with arms at his sides and minimal pillow support throughout his adult life, a disciplined man in every aspect of living. But gradually, his wife began noticing things she could not easily explain: long pauses in his breathing through the night, sudden sharp gasps, mornings where Robert emerged from sleep noticeably more exhausted and more disoriented than when he had entered it. When he finally met with a sleep specialist, the diagnosis was unambiguous: severe obstructive sleep apnea. His sleeping position was cutting off his airway up to 30 times every single hour. The mechanism is physiologically straightforward. When an older adult lies flat without adequate elevation under the head and neck, gravity acts on the relaxed tongue and the soft tissue of the posterior throat, allowing them to fall backward and progressively narrow the airway. Breathing becomes labored, interrupted, or briefly suspended. The sleeper is typically entirely unaware this cycle is occurring, but the body registers every episode with measurable physiological stress. According to the American Academy of Sleep Medicine, untreated sleep apnea in adults over 60 is associated with more than a 60% increase in the risk of stroke, cardiac events, and measurable cognitive decline. Nighttime blood pressure rises as the cardiovascular system attempts to compensate for an airway that keeps collapsing. Acid reflux layers additional risk onto this picture. Approximately half of all adults over 65 manage some degree of gastroesophageal reflux disease. When the body is horizontal with the head level to the stomach, gravity no longer provides its normal barrier against upward acid migration. Digestive acid moves freely upward, burning the esophageal lining, interrupting sleep with discomfort and coughing episodes, and over extended time contributing to the vocal cord and respiratory damage that physicians identify as silent reflux. For Robert, the accumulation of consequences had reached well beyond what any single intervention could readily address. Persistent fatigue, memory difficulties that worried him, blood pressure that resisted multiple medications. The discipline of a lifetime had become one of the primary drivers of his physical decline. Stillness during sleep is not the same as safety, and if lying flat creates these dangers, what about the recliner that so many seniors treat as their solution? What follows may significantly change how you think about it. If you are still here, please type 1 in the comments to let me know you are with me. Position number 4. Sleeping in a recliner chair as a regular or primary sleeping arrangement. The pattern almost always develops the same way. The recliner begins as an accommodation, a comfortable and familiar place to rest aching joints during the evening hours. And when lying flat in bed becomes reliably associated with pain, reflux, or breathing difficulty, the recliner begins presenting itself as the natural solution. It is softer than any medical device and more familiar than anything clinical. The first several nights feel like genuine relief. Dorothy was 79 years old, a widow from Arizona who had lived with chronic hip pain for nearly a decade. The recliner was the first thing in years that allowed her to move through the night without waking in pain. She defended it to everyone who raised concern. But gradually, the evidence arrived in her own body, undeniable and accumulating. Her ankles swelling reliably by midday, her lower back developing a stiffness that no stretching routine could address, her energy declining in a direction and at a pace that nothing explained and nothing reversed. What Dorothy did not understand was that her recliner was the primary source of the symptoms she had been attributing to advancing age. Sleeping in a semi-upright position chronically restricts the return of blood from the lower extremities toward the heart. Gravity opposes that return consistently across every sleeping hour. The result is progressive fluid accumulation in the lower legs and ankles. In its more serious form, this venous stasis creates the physiological conditions for deep vein thrombosis, clot formation in the deep vessels of the leg that carries the life-threatening risk of pulmonary embolism should a clot travel toward the lungs. The spinal consequences are equally real. The semi-seated angle prevents the intervertebral discs and the lumbar musculature from achieving the full decompression that sleep is meant to provide. Chronic tension in the lower back accumulates night after night. The hip flexors and core muscles that support postural stability weaken progressively over months of nights in a position that does not allow them to properly recover. The practical result is declining balance and a steadily elevated fall risk. And through all of this, the recliner prevents the deep sleep architecture the aging brain and body require. 8 hours in a recliner produces 8 hours of predominantly light sleep. The surface stages that feel subjectively like rest, but that lack the slow wave and REM phases in which cellular repair, immune regulation, hormonal restoration, and memory consolidation actually occur. The hours are registered. The restoration simply does not happen. Dorothy returned to a proper bed after her physician was honest with her about the trajectory she was on. "I thought I was taking care of myself," she said. "I had no idea the chair was taking something from me every night." The answer to all of these positions is not a different piece of furniture. It is a different understanding of how the body needs to be supported during the hours in which it heals. Part 2 provides exactly that understanding. Part 2. The 4 better sleeping positions for seniors. The first better position, side sleeping with a supportive pillow placed between the knees. Of all the adjustments available to older adults seeking better sleep, this one produces the most consistent and most immediately felt improvement. It requires nothing beyond an ordinary pillow. It asks nothing of the body beyond a thoughtful repositioning. And yet, for the spine, the hip joints, the cardiovascular system, and the overall quality of overnight restoration, it represents one of the most genuinely healing configurations the aging body can occupy. Alan was 71 years old, a retired firefighter from North Carolina, carrying a lower back and hip pain history that had become a defining feature of every morning. Pain management helped at the margins. The stiffness returned regardless. During a routine physical therapy appointment, his therapist asked him one question: "How do you sleep?" "On my side with my knees together," he answered. That evening, following her specific recommendation, he placed a small pillow between his knees and checked that his head was positioned at the height that maintained his cervical spine in alignment with the rest of his vertebral column. 2 weeks later, his morning pain had decreased by nearly half. It felt, he said, like his body had finally been given permission to exhale fully, for the first time in longer than he could remember. The science supporting this experience is thoroughly established. Research from the Cleveland Clinic confirms that lateral sleeping, and specifically left lateral sleeping, measurably improves venous return to the heart and reduces acid reflux episodes by maintaining the stomach in a position below the esophagus during sleep. The pillow between the knees fulfills a precise mechanical function. It maintains the pelvis in a neutral horizontal position and prevents the upper hip from rotating forward under its own weight through the night. That rotation in the absence of pillow support is what produces the compressive stress on the lower spinal joints and hip structures responsible for the morning pain that so many older adults have normalized as simply unavoidable. Physicians describe this as the alignment saver because it follows the body's natural structural curves rather than working against them across every hour of the night. It is also among the safest available positions for adults managing sleep apnea because the lateral orientation keeps gravitational forces from collapsing the posterior airway. For those who find sustained side sleeping difficult through the entire night, the next position uses gentle elevation to accomplish what positioning alone cannot fully achieve. The second better position, elevated back sleeping with the head and knees gently raised. Lying completely flat on the back is a position that many seniors have already moved away from, for the well-founded reasons we examined in Part 1. But with a single specific modification, that same basic orientation can become one of the most therapeutically valuable ways to spend the sleeping hours. The modification is deliberate and measured elevation of the upper body and the knees simultaneously. Physicians call this the elevated back sleeper position. For older adults managing reflux, breathing difficulties, or lower back discomfort, it frequently produces more meaningful and more immediate improvement in sleep quality than any other single adjustment. Linda was 73 years old, a retired teacher from California, whose nights had been defined for years by a predictable and unwelcome ritual: waking with a burning throat, a constricted chest, and a cough that announced itself before full consciousness had even arrived. Acid reflux had interrupted her sleep so reliably that she had largely accepted disrupted nights as simply the condition of her life at this age. Her cardiologist offered a recommendation so modest that it seemed unlikely to produce meaningful change. Elevate the upper body by approximately 30 degrees using a wedge pillow. Place a smaller pillow beneath the knees to allow the lumbar musculature to fully release. Linda implemented the adjustment with low expectations. Within days, the nighttime burning had diminished dramatically. Within 1 week, she was moving through the entire night undisturbed in a way she had not experienced in years. The mechanism is grounded in the same physics the body uses constantly during waking hours. Elevation during sleep allows gravity to continue serving its normal protective functions, keeping stomach acid appropriately contained, preventing the posterior airway structures from collapsing in the manner that generates snoring and apneic episodes, and reducing the cardiovascular burden of working against airway resistance across a full night's sleep. The American Academy of Sleep Medicine has documented that seniors sleeping with a modest upper body incline experience measurably fewer airway interruptions, translating into better overnight oxygenation, reduced cardiac strain, and more restorative sleep architecture overall. The knee elevation component completes the picture by releasing the sustained lumbar disc load that flat back sleeping accumulates through an entire night. For those seeking a position that addresses not only breathing and spinal support, but also the upper body tension that decades of physical life have deposited in the shoulders and neck, the next option may provide what the previous two cannot fully deliver. The third better position, the starfish, lying on the back with arms extended gently outward from the body and palms open toward the ceiling. There is something genuinely releasing about this configuration. The body spread open, the shoulders freed from the compression that both the day and the night before imposed on them. the chest fully available to the lungs without restriction from arms pressed against the sides or a mattress compressing the front. This is the starfish position. Its appearance suggests effortless passivity, but it is in practice one of the most actively restorative configurations available to the upper body during sleep, when the head and neck are supported appropriately. Linda, 69 years old, a retired nurse from Minnesota, had spent decades in work that placed sustained physical demand on her shoulders and neck. By the time she retired, those structures carried the history of that career as persistent shoulder aching and morning neck stiffness that reliably extended well past breakfast. Her chiropractor offered a recommendation that caught her off guard. Try sleeping like a starfish, arms relaxed outward from the body, palms turned gently upward, head supported by a contoured pillow sized to maintain neutral cervical alignment. She approached the suggestion with genuine skepticism. Within 1 week, she was experiencing changes she had not anticipated. The neck stiffness was less pronounced and resolved considerably earlier each morning. The shoulder aching had diminished meaningfully. For the first time in years, she said, she woke without the immediate physical weight of her age meeting her at the edge of consciousness. The explanation is physiologically clear and consistent. When the arms are extended away from the body rather than compressed beneath or alongside it, the pressure on the soft tissue of the upper back, the shoulder girdle, and the cervical nerve roots is removed. Blood flow to those structures improves across every sleeping hour. Research from Harvard Medical School's Sleep Division has associated this posture with reduced frequency of tension headaches and lower rates of upper limb nerve compression, one of the most consistent contributors to the chronic tingling and numbness in hands and arms that aging adults report and rarely connect to their sleep position. The fully open chest configuration permits unrestricted diaphragmatic movement, supporting deeper and calmer breathing cycles and contributing to the reduction in nighttime blood pressure elevation that cardiovascular stress accumulates in older adults over time. For those who find extended back sleeping eventually produces lower back discomfort, the final position represents the most comprehensively beneficial option the research currently supports for adults over 60. The fourth better position, the 45-degree side recline, what a growing number of specialists in geriatric medicine now describe as the optimal sleeping configuration for adults over 60. Imagine a position that occupies the space precisely between lying completely on your side and lying with your upper body gently elevated, your spine decompressed through every segment, your airway naturally maintained open without mechanical assistance, your stomach correctly positioned below the esophagus, your lower back free from the pressure that flat sleeping accumulates across a full night, your breathing happening effortlessly because nothing in your position is working against it. This is the 45-degree left lateral recline. It brings together the well-documented benefits of lateral sleeping and upper body elevation in a single, unified configuration that simultaneously addresses the most common and most consequential sleep challenges that aging produces. Walter was 78 years old, a former long-haul driver from North Carolina who carried decades of lower back injury, chronic acid reflux, and nighttime breathing difficulty that had progressively eroded his quality of life. He had pursued every available solution: successive mattress replacements, multiple medications, and ultimately the recliner that his physician eventually told him was accelerating his deterioration rather than resolving it. His physical therapist offered a specific and detailed recommendation. Position at approximately 45 degrees on the left side. Use a firm wedge pillow to support the back and prevent rolling through the night. Place a pillow between the knees to maintain pelvic neutrality. Use a third pillow beneath the head size to align the cervical spine with the thoracic column. The first night, Walter experienced something he could not initially process. He woke in the morning without the heartburn that had been a nightly experience, without the gasping that had interrupted his sleep for years, and without the hip and lower back pain that had greeted every single morning for longer than he could accurately recall. His sleep data over the following week showed deeper and longer restorative cycles than his tracking device had ever previously recorded for him. The research supporting what Walter experienced is substantial and consistent. Studies examining this posture have documented reductions in acid reflux episodes of up to 70% compared to supine sleeping. Airway maintenance equivalent to or exceeding standard lateral sleeping. Spinal alignment support appropriate for adults living with osteoarthritis or osteoporosis. And meaningful improvement in lymphatic drainage, the overnight clearance of metabolic waste from tissue, including brain tissue, a process directly linked to sustained memory function and long-term cognitive health. Sleep is not passive. It is the body's primary mechanism of physiological maintenance. The quality of that maintenance is not determined by duration alone. It is determined by the mechanical and circulatory conditions under which it occurs. The 45-degree side recline creates those conditions more completely than any other single position currently available to aging adults, protecting cardiovascular function, relieving spinal structures, maintaining airway patency, and supporting the deep restorative sleep architecture in which genuine overnight healing actually takes place. Sleep is not simply the space between one day and the next. It is the period during which the body processes everything the day deposited, repairs what was strained, consolidates what was learned, and prepares the systems that will carry you through tomorrow. As the years accumulate, that nightly process becomes progressively more important rather than less so. The body's capacity to absorb poor conditions and still generate adequate restoration gradually narrows. What could be managed without apparent consequence at 40 begins producing measurable effects at 65 and 75. The sleeping position that seemed irrelevant through the earlier decades of life begins to matter considerably. For adults over 60, the right sleeping position is not a comfort preference. It is a health decision with real and accumulating consequences for cardiovascular function, cognitive clarity, spinal integrity, and the physical independence that gives all other aspects of life their meaning. The body communicates through the symptoms it presents upon waking, the stiffness that does not resolve, the pain that arrives before the day has made any demands, the fatigue that sleep itself does not seem to touch, the gradual narrowing of physical capacity that arrives without announcement. These experiences are not simply the inevitable products of aging. They are in significant part the products of hours spent in positions that work systematically against the body's healing rather than supporting it. Small deliberate changes compound into meaningful results across weeks and months and years. A pillow placed thoughtfully between the knees, a modest incline supporting the upper body, a shift to the left lateral position, a wedge that maintains the 45-degree angle through every hour of the night. These changes require no prescription, no specialized equipment, and no fundamental reorganization of daily life. They require only the understanding that how you sleep is as consequential as how long you sleep, and the willingness to give your body the conditions it needs to do its nightly work properly. The body that is supported heals. The body that is strained accumulates damage in the dark. Every night is a choice between these two outcomes. I would genuinely love to hear from you before you go. Share one specific thing from tonight's conversation that you are going to bring into your bedroom with you. Let us learn from each other on this journey. If this video delivered real value to you, please leave a comment with 1. If it did not, leave a 0. Your honest response directly shapes what I create for you next. Please like this video and share it with someone over 60 in your life who deserves this information. Subscribe to the channel for more content built specifically around the health needs and realities of older adults. I am Dr. Lauren Hayes. Thank you for giving your time and attention here tonight. Here is to sleeping with intention, and to every morning that follows a night your body was truly able to use.